This was, incidentally, the second most popular question, because viewers would submit questions and then members of the public would vote. Why is marijuana illegal when alcohol and tobacco are more addictive and dangerous to our health, but we manage to control them? Wouldn't education about drugs from a younger age be better?
Well, there's one bit of that question I agree with, which I think education about drugs is vital, and we should make sure that education programs are there in our schools, and we should make sure that they work. But I don't really accept the rest of the question. I think if you actually look at the sort of marijuana that is on sale today, it is actually incredibly damaging, very, very toxic, and leads to, in many cases, huge mental health problems. But I think the more fundamental reason for not making these drugs legal is that to make them legal would make them even more prevalent and would increase use levels even more than they are now. So I don't think it is the right answer. I think a combination of education and also treatment programs for drug addicts, I think those are the two most important planks of a proper anti-drug policy.
But the argument that it could be used as medicinal properties, that was another question we actually had, a person saying it's got proven medicinal properties, if used properly and regulated properly, could actually be quite helpful.
That is a matter for the science and medical authorities to determine, and they are free to make independent determinations about that. But the question here about whether illegal drugs should be made legal, my answer is no.
You don't know what you're talking about, do you?
The policy on cannabis has been wrong since it was brought in the 1970s. It's been wrong because cannabis is a medicine, has always been a medicine, and should be available to patients in this country as a medicine. And of course, the other aspect of the cannabis policy, which is criminalizing young users, has created an underclass. About 1 million young people, many of them black or Asian, have been given criminal records for cannabis possession. And we know that the criminal record is going to do much more harm to their lives than the cannabis that they smoke. So on both counts, stopping medical research, stopping medicine, and inappropriately criminalizing people, it's not just wrong, it's been a disaster. The politicians need to be honest about what they know. Most politicians know that cannabis is less harmful than alcohol. Most of them know that the law actually is doing more harm than good, but they just haven't got the courage to say it. The two main parties are sort of in a Mexican standoff. They're looking to see which one's going to move first. And if one moves, then the others will attack them to try to get political advantage before the next election. We spend £2 billion a year criminalising people for using cannabis. £2 billion. That should be put into treatments or research. A complete waste of money. Everyone knows about the ABC classification. A being the most harmful, C being less harmful. Everyone also knows that drugs are in the wrong classes there, but put that to one side. There's another form of regulation called the schedules. And drugs which are put into Schedule 1, like cannabis, like MDMA, like psilocybin, this schedule is treated as they are the most harmful drugs. Whereas drugs that are put in Schedule 2 or 3, hospitals can hold. So any hospital can hold heroin or morphine or even cocaine, because those are seen as medicines, and therefore hospitals and pharmacies can hold them. But Schedule 1 drugs are not seen as medicines, so you need a special license to hold those. Within the cannabis plants, there are about 80 different chemicals, many of which are likely to have medicinal value. What we know from the work that has been done, and a lot of this was done before cannabis was banned, we know that cannabis has particular pain-relieving properties. It has properties to reduce spasticity and muscle spasm. It has quite an interesting profile in terms of cancer. A range of cancers seem to respond to cannabis. There's an enormous potential range of opportunities. In fact, I saw a paper last week showing that cannabis can reduce the production of the amyloid protein, which can cause Alzheimer's. Really? In mice. So it might even be anti-dementia. But most of those studies have not been properly developed in humans because there's virtually no one in Britain with a license to do cannabis research in humans. I say 4 hospitals in the whole country. There's 600 hospitals, only 4 of them can hold the drug.